Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce and sponsored by Beach Walk Cafe. I'm your host, Amy Perry, and our guest today is Dr. Janardhan. Did I say that right?
You sure did.
Yay!
Thank you.
Okay, there are so many letters behind your name, it's like an alphabet. So I'm just going to say that you are a cardiac electrophysiologist and a cardiologist.
That's correct.
Which means you haven't been to school, you don't know what you did.
Right. I just came in off the street.
You just came in off the street. No, I know you've been to school for many, many years. Can you tell me a little bit about where you went to school, how long?
Sure. Yep. I'm a biomedical engineer. I went to school in Boston, and I did my master's in biomedical engineering. Then I went to Stony Brook and in New York, where I did my MD and my PhD degree. So I thought I was going to be a geneticist. I did a PhD in genetics. And then I went to training at Washington University in St. Louis for about 8 years. And that's where I did internal medicine, general cardiology, and then cardiac electrophysiology.
All right, so tell me exactly what is cardiac electrophysiology?
Good question. So cardiac electrophysiology is electrical problems of the heart. There are what I call plumbers and electricians in cardiology.
Okay.
Some people have the arteries to their hearts that go bad and they have heart attacks. Unfortunately, a large number of people have electrical problems of their heart and they need pacemakers or defibrillators, or they have these abnormal heartbeats that can cause strokes. And so that's when they come and see me, and we try to cure them of those.
And somebody doesn't just walk in off the street. I would imagine another doctor would
Yes, generally internal medicine physician or a cardiologist, once they've sort of tried their medical therapy and they need to go the next step, that's when they ask me to see their patients. Any
symptoms that just the average person should be aware of? I mean, I've heard, if you have pains down your left arm, that might be
pain,
along with others.
So the heart attacks, pain in the left arm, squeezing, tightness in the chest, those are usually people who are having heart attacks. In women, it can present a little atypically, but for me, it's generally people who are passing out because their heart rate's going too slow, and they need a pacemaker, or they have these abnormally fast rhythms where they feel their heart racing out of their chest. Unfortunately, there's a significant number of people who don't know when they're having an abnormal heartbeat, and they just feel a lot of fatigue or they're sleepy all the time. And those are the patients who are at risk for stroke from a common condition called atrial fibrillation. And probably about 80% of what I deal with is atrial fibrillation.
And are you seeing people after they've had this stroke and then?
No, we generally try to see them before.
Try to prevent it.
Yes, that's exactly. When patients go into these diseases like atrial fibrillation, we can use our catheters and our techniques to actually cure them of these diseases, and that's what we try to do.
So what keeps the heart, like I'm familiar with the pacemaker that keeps it beating. When you go in with your catheters, what are you doing exactly? Are you putting in pacemakers? Or?
Right. So if somebody has a slow heartbeat, we'll generally put in a pacemaker, and that will take over for their God-given natural pacemaker, and they'll feel a lot better. When somebody has atrial fibrillation, they develop extra pacemakers in their heart, and these abnormal pacemakers fire and fire rapidly, and they cause the top chamber of the heart, rather than beating uniformly, they cause it to quiver, and then the blood pools, and then it can clot and then cause strokes. So what I do with a catheter is take it to find those abnormal areas that are firing, and cauterize them or freeze them, and that once those are sort of dead, the normal pacemaker can take over and the normal heartbeat can replace the abnormal one. So
that is amazing.
It's hard to describe in words without pictures, but that's basically what we're doing.
You did a great job, because I understand it, and I'm not a medical person. Tell me where you operate out of.
So I'm primarily based at Fort Walton Beach Medical Center. That's where I do all the complex procedures. That's where we have all of our expensive equipment, and that's where we have trained staff that I've recruited from various parts of the country. I do office hours out in Crestview, some in Destin, and some in Fort Walton Beach. But most of my complex procedures are done at Fort Walton Beach Medical Center.
Okay, this is going to sound like a really stupid question, but aren't all your procedures complex? No. It sounds like they would all be really.
Yeah, it's. I guess to me, there are some that are highly complex, and some that are, and I kind of judge that based on the risks. You know, there are high risk procedures, and then there are low risk procedures. So, but yeah.
Okay, so I have two more burning questions. What should just the common person do? Is there any way to prevent the things that you work on?
Yes.
Is it like diet, exercise, or should we all be eating potato chips?
Right. So what I like to tell patients is what I do is sort of half the story, okay? Because I try to go out and remove the insult to the heart, or try to make it normal. But if people continue to have very high blood pressure, lack of exercise, lack of sleep, sleep apnea, and excessive alcohol. Those are sort of my big factors, and obesity. So those are the things that I try to modify in my clinic. Okay. So yes, we might do your ablation, but then we spend the rest of the time aggressively trying to figure out how to improve those risk factors. And the good thing is patients who have these abnormal heartbeats are the most motivated patients. They don't like being in these abnormal heartbeats. And so we figure out strategies that work for the patient to lose weight, which is still the hardest thing for everybody to do. You know, so, but yeah, so it's kind of like we do these two things in parallel. And if we do those two things in parallel, the data shows that we have the best outcomes.
What is your favorite thing about what you do? Just in general, and then I'm going to ask you about the actual surgeries, but what's your favorite thing?
Yeah, my favorite thing is when, after the procedure, when I see patients back in the office and they've been living with these abnormal heartbeats or diseases for so long, and once we've actually made them feel better, they are so happy, and I can just see that. You know, they tell me, well, you know, I used to always have to take a nap in the afternoon. Now I can go all day. You know, we find ourselves going out to dinner more because I have energy at the end of the day. So that's what makes me feel like I've done something good. So that's why I'm in it.
I can imagine. And then for the actual surgeries, do you have a favorite procedure? I know that's a weird question, but I would just think.
Yes, so probably the procedure I do most is atrial fibrillation, and from the first procedure I did when I was in training, I enjoyed doing that. We use we don't actually use X-ray. We create an artificial map and 3D images of the inside of the heart, and it's just really neat. And you know, I think part of my background as an engineer. It's all the newest technology, and when I'm in doing my ablations, I'm in my place, you know, so.
Perfect. I am so happy that you are here. I hear that you're relatively new to the area, but you have been told that you are staying here, I believe. The missus said that.
The happy wife, happy life. Yes,
yeah, there you go.
I promised my wife we are not moving, and so we're very happy here.
Well, thank you. And come back. Maybe we can do, I don't know, a surgery or something?
Maybe we can do it in the hospital.
All right. Thank you, doctor. I really appreciate it.
Thank you for having me.
We'll be back.